For today's webinar agenda, we will be going over our Therap implementation, timeline, go live prep, data archiving for NetSmart visits, documenting visits in Therap, the Therap import and export process that includes member demographics as well as prior authorizations, and our Therap, we'll be discussing our Therap Town Hall series, training, and resources available to all of our providers using Therap. So here for our Therap implementation timeline, our Therap Go Live is planned for January 1st of 2025. So that doesn't mean, though, that everybody has to have all their members into Therap on January 1st. There is a little bit of a staggered time frame. That time frame is January 1st through January 31st. In particular, some of our providers that have participant direct services, that they will want to end those visits currently in that NetSmart platform, like at the end of a pay period, and then begin visits over in Therap, the next day after that pay period. So that's the reason why we have a bit of a staggered time frame throughout January of 2025 to begin using the Therap platform. You will be able to enter visits and send data to the aggregator if you're using a third-party vendor. So as of February of 2025, though, there will be no new visits in the NetSmart mobile caregivers platform, and providers will only be able to edit visits over in the NetSmart platform. And moving on into March of 2025, the Mobile Caregiver Plus will become a view only. And then as of April the 1st of 2025, that mobile caregiver access, including your NetSmart dashboard, will go away. So all visits, of course, by that point will be into the Therap platform. So also a reminder, provider agencies that have contracted with NetSmart to continue as a third-party vendor will continue entering visits, though, in your mobile caregiver after January 31st, but then your agency would be in the aggregator responsible for transitioning those visits near real time to the Therap aggregator. Preparing for our Therap Go Live. If you're using the Therap EVV platform as an agency, some of the checklist items that we will talk through today is, have you completed your Therap job form for your agency? And basically what that does is that allows Therap to connect with you as a provider agency. That's a one-on-one meeting. They will do some onboarding with you, and then also, begin to understand the services that your agency is certified to provide. And then they will also, of course, schedule and or hold, a setup call with Therap. If you've not had that yet, or if you have questions about that process, please let us know. You can, at the end of the deck, there will be resources for you to contact Therap as well as us at the 1915C Waiver Help Desk. And you will also be responsible for completing your setup through the Therap EVV solution, which includes setting up your admins, users, and billing if applicable. And then there will be also training completed with Therap, and we'll get on over into that discussion here in a bit. So Therap will be providing agencies with one-on-one training, and then there's also many resources available and simulators, etc., for agencies to become familiar with the Therap products. And then also, as an agency, we encourage each of you to make plans for shifting to Therap, or with your third-party vendor, aggregating that data between January 1st and January 31st of 2025. So if you're using a third party for EVV, your agency's checklist, completing that job form, receiving and completing the third party EVV vendor attestation requirements, signing and completing the business associates and end user legal agreements, and receiving the Therap aggregator API specs and testing credentials, and also, ensuring that your agency's third party vendor has completed these steps. The third party system must begin sending those visits to the Therap aggregator no later than January 31st, 2025. And that data should be sent to the Therap aggregator near real time from your agency's third party vendor. I know a few weeks ago now, and this is also posted on our webpage, we had sent out directions on archiving your current NetSmart data so that you can access it at a later date. So providers currently using the NetSmart platform to complete visits, you will need to download and retain copies of that historical EVV data for auditing purposes. And again, that's important to remember that you will need to do this before April 1st because that access to NetSmart will be gone after that point. And this will include providers contracting with NetSmart that uses the Mobile Caregiver Plus as a third-party vendor. Providers switching to Therap must download that data from the date they begin using the Mobile Caregiver Plus through the date that you will end before the next day transitioning to the Therap platform. So you must ensure that you have those visits downloaded. Providers who plan to stay and use NetSmart as a third-party vendor moving forward must download the data from the data they begin using the Mobile Caregiver Plus through March the 31st of 2025. And then at that point, all Mobile Caregiver Plus data associated with us as the EVV mandated source for NetSmart, that will be deleted after that date. So we also have links in this presentation that will be going out and also posted to our webpage on how to complete downloading that Mobile Caregiver Plus data from the guide. A timeline recap. Again, we'll just kind of go over this, and all this has been communicated out and is also available on our page if you need to go back and reference it. So our timeline recap for this transition, January 1st of 2025 is our go live. Providers can begin documenting visits in Therap or sending visits to the Therap aggregator if using a third party. By January 31st of 2025 is the deadline to complete transition to Therap, documenting visits in Therap or sending visits to the Therap aggregator. So February 1st through the 28th, no new visits can be documented using NetSmart unless your agency, again, has contracted with NetSmart as the third-party vendor. March 1st, NetSmart becomes view-only for provider agencies except those that are contracting, again, with NetSmart as a third party. And by March the 31st is the final day to download those historical data visits, and providers switching from the Therap and providers contracted to use NetSmart. So all that must be downloaded before that point. And then by April 1st, the NetSmart logins for Mobile Caregiver Plus, as well as your NetSmart dashboard, will be ended. You will no longer have access, except again for those providers who has contracted with NetSmart to be a third-party vendor. So now we're going to go through a few slides on the task of using the Therap solution. This is the mobile solution. Provider agencies will no longer have to create tasks associated at an agency level. This is now has been added to the Therap mobile app and will generate a standardized list by program waiver and also the service code that is being provided. The paid caregivers must select the tasks that they provided during each of the service visit as it should correspond to the member's person-centered service plan. And also there will be a link here for additional information related to those tasks. I know one of the things that it was discussed on the November 14th Therap Town Hall, as well as today's Town Hall scheduled at 2:30 p.m. Eastern Standard Time, is the import and export process. So both member data and service authorization, that's your prior authorization, can be exported from the Therap aggregator and then imported into the Therap solution for those agencies that are using the Therap solution. Data can be exported or imported manually as well as also this bulk upload. And we are recommending that those exports and imports are going to be done weekly, especially for service authorizations, to ensure that if there's any modifications that you all have the most current service authorization uploaded into your service authorization in Therap solution. Only Therap users with the IDF admin role can complete the member export import process, and only Therap users with the billing admin role can complete the service authorization export and import. And again, in the deck that you will be provided is a link to the town hall where this was discussed, and then again on today's town hall at 2:30 p.m. Eastern Standard, Therap will be discussing further this process for the import and export, as well as we are going to be sending out further communication and a quick reference guide, job aid for this process. If you're using a third-party vendor for Therap after we transition, you will need to work with your third-party vendor on how to address the member and service authorization uploads in that process with your third-party vendor directly. Town halls, trainings, resources. Again, today we have a town hall scheduled at 2:30 Eastern Standard Time. They are scheduled now every Thursday throughout our transition time frame. And then also, if you've not registered or if you've not attended, there will be a link for you to do that. And then all of those Therap town halls have been recorded and are available on our Kentucky's Therap page, as well as the commonly, most frequently asked questions and responses to support resources on the Therap webpage. So all that information is available and will be provided to you all. This time we will go through and look at our questions and answer them here during our call.
So the number one question I've gotten so far is this being recorded and will these links be available? So it is being recorded. We will post the recording, the slides to the Kentucky EVV website, which I put in the chat a couple of chats ago. So you can either pull that from there, or we will send an email notification to everyone who registered, and to our provider list, letting you all know when those links are available, so you don't have to go search for them.
Well, it
Okay,
looks like one of our questions that we have currently, who does our agency need to contact to gain access to the aggregator? I've tried to assign this from our organization management app, but it is not an option. So with that, I know that there's some called access involved for assigning those roles. Um, I'm going to suggest that you work with the Therap support help desk with that if you've not done that already. If you have, please let me know, and then we will take a look at that and see how we can assist you. Yes, for the service authorization uploads, the question was asked, are these the MWMA prior authorization documents? And yes, they are. They are the prior authorizations that have been approved. So those will go over to the Therap aggregator. And then for those users using the Therap solution, you will have to export that data from the aggregator and import that data over into the Therap solution.
We get, I think I've had a question, yeah, come through the chat, as well as there's another one similar in the Q&A about the aggregator and whether it's available now.
It is not available now. It will be available January 1st.
So next question is, when will the prior authorizations be imported from the state?
So I know that I also have Jade on the call, but they still would not be able to access those prior authorizations before January 1st. Is that correct, Jade?
So, we will have, the prior authorizations available, next week. And as Therapy begins onboarding, they'll be able to see those authorizations. So once you meet back with Therapy again after next week, they'll help you to, get those authorizations and get those uploaded.
Thank you, Jade. Looks like we have a question in regards to training or handouts available that we can give families besides the simulator on the Therap app. Um, Loma, we will take that back. We have a call today with Therap, and we will see what additional resources there are available. Thank you for that question. Peyton, I know that you all have a meeting scheduled next week with Therap to discuss your authorization import in particular. So I believe your data will be available as you all start meeting with Therap. So more information to come on that, Peyton. So we will take care of that. Oh, thank you, Jason. So the aggregator access will begin on December 10th to allow access to authorizations, but visits won't go until January 1st. Thank you, Jason, with there for that comment.
So we've got a few more there in the Q&A.
That is correct. The prior authorization will not automatically update in Therap today.
We also had a question from an agency who's been using Therap for years, so they're wanting to know, is there anything they need to do as of January 1st?
So you will need to ensure that you have downloaded those historical visits from NetSmart platform, and your agency should have worked with Therap through the onboarding process to prepare for the transition to Therap as of January 1st.
Yeah, April, this is Jason. If I could step in on that one in particular, the actual change for the existing Therap users will be with the authorization. So you'll need to have the updated authorizations taking effect on January 1st, and those auths are what's going to effectively direct traffic and make sure your visit data goes to the proper aggregator effective January 1. And certainly if you have any questions about that, you're more than welcome to reach out to us at Therap.
So we do have a question if there are simulator trainings available for staff who are training on Therap.
Jason, can you kind of give us a brief description of the trainings and resources that Therap offers, please?
I can. So the simulators are effectively just kind of a point and click version of the mobile application for staff to walk through so they can understand where on the mobile device to check in and check out. Those are available on our site. Just to put a plug in for the town hall that you heard April mention earlier. Later this afternoon, we're going to be going over a lot of this export import information, but we'll also be sharing particular links to those simulators. That's going to be part of the information that's shared later this afternoon. So you can get direct links to those tools, which are great to distribute amongst their staff so that they can get used to that process.
Okay, Jason, we have another question for you. Is there a way to add multiple diagnosis codes to that member import? Or will that be covered this afternoon?
We can discuss that this afternoon. The short version is you can put multiple diagnosis codes in our system for the import purposes. We're doing one at a time to get the members in there and the authorizations in there and active, but you then have the ability to go back in and add additional ones later to the IDF, but we can certainly talk about that later today.
I have a few more coming into the chat there. April, I'll let you take a look.
Okay. Okay. Bethany, if you want, Kelly, I'm sure you had provided our 1915C waiver help desk to Bethany, so we can do a direct outreach and follow up with them. And then, Jason, one of the questions I was going to ask you later this afternoon for one of our agencies is there any type of written job aids, etc., outside the simulator for the mobile app?
Yeah, just in terms of user guides and training materials, we have quite a few of those. They should be linked off the Kentucky EVV site. We'll make sure that we share those in the town hall later today as well.
Thank you so much.
Of course.
Okay. Let's see here. Looks like we have a new user that's a newly certified provider that has not used NetSmart yet. and asking how they get started. So again, on that particular one, if you will, Kelly, if you don't care for Charlotte there, we will get you information. We'll collect your provider information and ensure that you get connected over with Therap on next steps and how to start. So Jason or Jade, this might be one that you all could help us with here from a policy standpoint. When will our third-party EVV vendor have access to the prior authorizations?
The authorizations for the third party will be available in the aggregator at the same time for third parties as it is for Therap EVV users. It's all going to be going in on the Monday the 9th is when it should go into the system. That's why we're telling everybody that it will be available later in the week, beginning Tuesday. But yeah, the data for both the the Therap EVV users and third party vendors will be in the aggregator at that time.
Thank you. Will providers be able to go in and correct their start and end dates with the Therap app, or will this be a role of the admin? So there will be a dashboard in the Therap solution that will allow the agency admin to update and modify those dates for beginning, start, and end times. Is that correct, Jason?
That's correct, yes.
So yes, so there is a visit verification signature requirement of the member that is being served. So that requirement is available. So for both HHCS and PCS. So that is available now in the Therap solution. Melinda, if you could please email us, we will get you over in the right direction about your third-party vendor. So Heather, your question in particular is more specific. I would recommend working with your assigned Therap training, onboarding coordinator in regards to that in particular process. Yes, if you're using a third-party vendor, you will get a login for the Therap aggregator, or those visits to review those visits, and then also your third-party vendor will transition that visit data over to the Therap aggregator near real time.
And just to clarify on that, April, the login will actually come through COG. It's not a direct login to the aggregator. You would go through COG and we'll then be able to link directly down to the aggregator. But the credentials of the two applications will be synced.
Thank you, Jason, for that clarification. We have a question in particular about a recommended username format. Upon the import and adding users. So I believe that Jason Therap would cover that more in the agency provider one-to-one training onboarding session.
Yeah, we would cover that with you. I mean, Truth of the matter, it's at the discretion of the provider, but we can certainly discuss options with you on our calls.
So a couple things coming through the chat. Just a reminder, folks, if you have questions, to put those in the Q&A box, but I'll just grab these couple out of chat. It seems like there's still a little bit of confusion about when they can start using Therap. So April, I don't know if you want to go back over that.
Yes, so you can start using Therap to complete your visits if you're using Therap Solution January 1st to January 31st. So you have a little bit of a leadway to start completing those visits over into the Therap platform. Okay, so January 1st is our go live, and then we're giving kind of a month cushion to ensure that all providers have their individuals uploaded into the Therap solution, and then also they have the needed PA data. So after February 1st, there will be no new visits in the NetSmart Mobile Caregiver Plus. You will only be able to edit visits there in the NetSmart platform after February 1st. So January 1st is our go live for Therap solution. And then also, if you're using a third party, we would expect to start seeing data transitioned from your third party's visit data over into the Therap aggregator.
One more from the chat. So some questions about signatures. I know when we switched, when we did EVV initially, this was a lot. There were a lot of questions about signatures and who can sign. They also noted that in home health, they have the employee signing and not the patient. For that, I'm going to throw a link in the chat to some information that we sent out, I think last week. But if you want to go over maybe signature requirements, April, I think that's probably a good one.
Yes. So signature requirement. So at the end of the visit, upon clocking out, we are expecting to view and see that the participant member individual being served is the person who has signed for that visit, because in the Therap platform, when you clock in, clock out, that captures the employee's information there in the system. And I don't know, Jason, if you have any additional information to add to that piece of the solution.
No, effectively that's it. The check-in and check-out process is associated with the electronic signature of the user, so it doesn't have to be an additional point of entry. The signature piece on our mobile application, the finger sign off, is for the service recipient or their authorized designee.
Thank you. So another question about signatures here. What if the participant cannot sign on the Therap platform? It also will capture a voice signature requirement. And if that's not available, you will it will create a exception for you to enter on the agency's dashboard to move that visit over to the aggregator. So one of our questions here is around when you start when you move your individuals over to the Therap platform, that's where you should then finish all the visits in Therap. You shouldn't go back and forth between using both Therap and NetSmart. So once you've transitioned your participants, members over, your employees into using Therap, that is the platform that you will utilize. Yeah, so for prior authorization, service authorization updates, So if there's a modification or a change, that's the reason why we are currently recommending agencies to do that export import process manually at least once a week to capture any modifications in that service plan, that prior authorization that is uploaded into MWMA. So if you've had an initial onboarding meeting with Therap, that follow-up meetings, Jason, can you kind of go over what agencies might expect through the onboarding process?
I can. So if you have already had your initial meeting with Therap, our representatives are following up with respective agencies. And if you've not received a note from them, you should within the next day or so. We're in the process trying to get those scheduled now. If for whatever reason something slips through the crack and you don't hear from us within the next couple of days, please feel free to reach out to us directly at the KY support alias and we'll follow up. But you should hear from us within the next day or so. If you have not yet completed your initial visit with us or your initial session with us, we need you to reach out to us immediately so that we can get that piece done. That has to be done before the export import process for the authorizations. We need to do the initial configuration. So we need you to reach out to us immediately if you've not done that. So those are basically the two scenarios that should address everyone, I would think.
And I've gone through and put their contact information there in the chat for you all, but that's also on our website. So it's out there in a few places.
So we have another question. There's a question in here. We're only a service provider and do not have access to MWMA. So if you can, we will follow up with you directly, Sherry, on your questions.
All right, quick time check. We're just at about quarter till the hour. So we'll try to get through as many as we can. I know, if we miss an answer or something, you are of course more than welcome to reach out to us. And I will put DMS's information in the chat again. Although I think at this point you all pretty much know how to reach us. But and we will answer like in writing individually if we need to, or if we're seeing a lot of like common questions, maybe we can have that added to like an FAQ or just kind of send out a notice addressing that directly. What I have noticed a couple of times in the chat that I'll just highlight, and I'm going to put a link in the chat, is just some questions about like which services. Nothing has changed with which services are required to use EVV. So if you were using EVV before with NetSmart, now that we're switching to Therap, it's the same services, same waivers, everything, just a different system. But I put the link to our document that lists all of the services that are impacted by EVV in there. So I'm gonna just take over here and kind of go through these last few questions. There's a couple folks that have noted that the simulator on the Therap website does not show either party signing when they finish the visit, but they're wanting to know if the app will do that, like when it's live.
The app absolutely will have that in there. We also have some resource materials. I was just trying to think back through the actual simulator. It may not have that particular component, but we have a user guide that does. That will be part of the information we share at this afternoon's town hall so that you have the appropriate resources for that. But yes, the app will absolutely include that piece.
Thank you, Jason. I appreciate that. We have got, let's see, we've done that one. Sorry, guys, we're kind of just going through them live here, so it's a little bit tricky. I know, I don't know that we can answer this one. April, we may need to have this person reach out to NetSmart. They understand claims can be mass downloaded. Is there a way to do this for the native visit info? I don't know if we know the answer to that or not.
So that I would have them reach out to NetSmart directly to the NetSmart customer service. And Nicole, if you need that information, you can message us and we'll make sure we get that to you.
Okay, and I threw that information in the chat as well. There's obviously the option to put in a ticket or just to give them a call. So that is your preference. And we've talked about new PAs, they need to be pulled and uploaded every time. So again, they will go over that a little bit more detailed in today's town hall. So I did put the registration link for today's town hall in there. If you register, I believe for previous town halls, you should be able to just use your same link. But just in case, that would definitely be a good one to make sure you attend and get that information. Question about if the app just requires check boxes or notes required for the system. I believe it is check boxes is
It is
the answer.
checks boxes.
Yes, and we put together a little guide with all of so you can kind of see which tasks for each service. And I threw that in the chat. And again, we'll email all these links out too. So don't get too worried if you haven't been able to pull one out of the chat. I promise I will get them out to you as quickly as we can. Let's see. Can a participant's representative or designee sign the visit after the visit has already been completed, or is this only available at the time of the service ending?
So visit verification is truly a process at that time of that visit is occurring. We are also working with our sister agency, Department of Aging Independent Living, into some additional information around the PDS rep row for those utilizing participant direct services. So we are still working and reviewing information around that process.
Okay, so one last question. This is once again related to that data download from NetSmart. So this is one we may need to take back and or maybe need to have you reach out to NetSmart. So let's see, they want to know if they should retain all visit records with tasks and signatures for auditing purposes, or will the claims reports be sufficient even though they don't show which tasks were performed and have the signatures on them?
So we will take that back and provide some additional guidance around that historical data export process through NetSmart.
All right, guys, I'm going crazy on the slides there. Okay, we are at the end of our questions. I did get one more in the chat about the PowerPoint, and will that be sent out? Yes, it will be posted to our website and sent out. I would say give me through the end of Friday. I will try to get it to you at the end of this week. Monday at the very latest. The editing process for the recording takes a minute or two, so that's usually what the holdup is, but we will try to get that out as quickly as we can. I don't think I've got that timeline up there on the screen because I know there have been a lot of questions about that. There's a letter, which again, I put a link to in the chat that kind of goes over all of this too, but it'll be in the PowerPoint, which we will post and send to you all as well. Let's see, I'm not seeing any more questions come in. I am going to skip over to our resources screen just so you all can take a quick glimpse at that. Again, everything on the resources screen are things that we've kind of put in the chat that you all will be able to you all will be able to see in the email that we'll send out once everything's kind of live and online as far as the recording and the deck. So that way you'll kind of have it all in one place, but there it is as well. April, do you have anything else that you want to add or?
Thank you, Kelly. Now, we are very excited about this transition, very excited for our providers to begin using and working with Therap. I know that you all have already been in contact and working with Therap on the onboarding process, training, etc. But we are very excited about this transition, and we look forward to hearing from you all and feedback. If you have questions or additional comments, etc., we are happy to hear them, and we will work with you as the provider as well as Therap and ensure that everybody is ready to go on January 1st. Thank you.
Okay, so I will do one more plug. Again, there is a town hall today at 2:30, correct? Sorry, I get my times mixed up. 2:30. Thank you, Jason, for confirming that. And we will go again, I think Jason Therap, they will go further into like the import exports. I know because there were a lot of questions about that. So you all will definitely want to make sure you're there for that, as well as other topics that I think are very important. So just another plug for that. If you were not planning to attend, hopefully you can make some time and be part of that. Otherwise, I'm not seeing any more questions. So we will go ahead and wrap up a little bit early. And we just appreciate you all for being here. We hope to see you later this afternoon. And again, if you have any questions, comments, anything, please feel free to reach out to us.